Okay, really, really important question of the day. If my pelvic floor is super, super strong, do I have better orgasms?
Yes or no? So this is a tricky question.
Welcome to Carrie On, the show where we explore reinvention, self-discovery, and empowerment before, during, and after midlife. I'm your host, Carrie Murray. It's time to keep our head above the chaos and carry on.
The Carrie On podcast is a space for honest conversations, personal stories, and powerful perspectives. While we may discuss health, wellness, finances, relationships, and social issues, the content shared is for informational and storytelling purposes only and should not be considered professional, medical, legal, financial, or therapeutic advice. Some episodes may contain sensitive topics or adult language. Listener discretion is advised. The views expressed by guests are their own and do not necessarily reflect the opinions of the host or affiliated organizations. We encourage listeners to seek out qualified professionals for guidance tailored to their individual needs.
Today, we're diving into a topic that, let's be honest, no one really prepared us for: the menopausal vagina. From unpredictable mood swings to changes in energy, sleep, and everything in between, navigating hormonal shifts can feel like a full-time job. But how do we understand what's happening to our bodies and find balance? Today, we're joined by Dr. Sara Reardon, a board-certified pelvic floor physical therapist with over 18 years of experience helping individuals prevent and overcome pelvic floor issues, which include urinary leakage, painful sex, prolapse, and discomfort during pregnancy, postpartum, and menopause. Sara has been featured in Time, Yahoo, Harper's Bazaar, Romper, InStyle Today, and numerous other podcasts, publications, and professional conferences all over, all about her advocacy and educational work as a pelvic floor therapist. She is also a TEDx presenter and spoke on rethinking postpartum care. Sara is the founder of the V-Hive, an online, on-demand pelvic floor fitness platform for pregnancy, postpartum, menopause, painful sex, and pelvic floor strengthening. Sara lives in New Orleans with her husband and 2 sons. We're lucky that Dr. Sara will shed light on the roller coaster that so many of us experience when it comes to our bodies, especially our vaginas. Her new book, Floored, a complete guide to women's pelvic floor health at every age and stage, is a rally cry for women's health and the muscles involved in day-to-day functions. From peeing and pooping, sex and childbirth to menstruation and menopause, Dr. Sara's authoritative guide provides the insights and the strategies every woman needs. She's here to help us get a handle on why it sometimes feels like everything is out of whack, and most importantly, what we can do to feel our best self again. Let's dive in. Tell me about the name.
I know. It's a great one, the Vagina Whisperer. So I wish I could take credit for that nickname, but it's really due to a group of my girlfriends from college. After graduate school, I started practicing as a pelvic floor physical therapist right away. And one summer, we were all gathering at a friend's house in Massachusetts and sitting in the pool. And all of a sudden, I started talking to their moms, the mothers and their friends, about pelvic floor issues. They were telling me about leakage and pelvic floor heaviness. And so, I'm, 27 at the time, and I'm talking to a bunch of older ladies about their pelvic floor. And so, gradually my girlfriends kind of started trickling out of the hot tub, and I'm left with this older group of ladies, and they were like, "Oh, Sara's like the Vagina Whisperer." And so they really gave me the name. And when I started my Instagram account, it was for our group of friends, pregnant and postpartum, for me to share tips with them. And so I called it that for my group of friends.
I love that. I love that. So I've never actually heard the term pelvic floor, and I've had 2 kids. I even only have gone to female OBGYNs. Never have I ever heard of that term until I was in a yoga class. And then I was like, pelvic floor? What's that? So the fact that now I feel like it's everywhere. Oprah's talking about it. Cameron Diaz is talking about it. Halle Berry's like all of a sudden these famous pelvic floors won't shut up about it. So I think that's a great trend that's happening. But tell us, in case somebody watching or listening to this doesn't even know what a pelvic floor is, just give us a quick anatomy of what exactly is it. What does it
Well,
do?
Carrie, you're not alone. So many women don't even know they have a pelvic floor or even know that it could be responsible for some of the issues they're experiencing, like urinary leakage or painful intercourse or pelvic organ prolapse. Your pelvic floor is a basket of muscles that sits at the base of your pelvis. So we're all used to that kind of bony skeleton of pelvic bones. And at the very bottom, there's a hammock of muscles that support your pelvic organ, like your uterus, which holds a growing baby, your bladder, which holds urine, and your bowels, which hold stool. And the pelvic floor muscles have three openings, one for where urine exits, one for the anal opening, and then the vaginal opening for intercourse, menstruation, and vaginal birth. So if you had any issues in that area, or things change during pregnancy or birth or menopause, your pelvic floor needs attention. And yet we don't talk about it when we're experiencing these issues. It's often a therapy of last resort, or women like yourself end up finding out about it from somewhere else.
Gotcha. So really quick. So if someone is experiencing, urinary leakage, anything like that, that's a pelvic floor issue, not just you
100%.
sneeze too hard or you laugh too much.
Well, exactly. I mean, a sneeze is a sneeze and a laugh is a laugh. But what happens is these muscles are supposed to keep the urinary sphincter closed with those activities. And when the muscle can't coordinate, or it's not strong enough, or it's too tense, leakage gets through with that pressure. So it's really about training the pelvic floor to hold tight effectively when you get pressure from a cough, a laugh, or a sneeze. So it's really training the muscles, not sneezing less hard, that need to be addressed.
When you've sneezed and you're like, hold on, I don't want it to go anywhere. Gotcha. Okay, so now you've also wrote an amazing book about it. It's called, first off, it's a hilarious title, Floored. There it is. Everyone needs to get a copy. We're going to put it in the show notes and we're going to link it here if you're watching this on YouTube. So tell me about like how women who are experiencing pelvic floor problems, they've been dismissed by doctors, they're not being listened to. Like, how can we advocate for ourselves besides following you on Instagram and going to your office? But you are in New Orleans. Now we want to read your book, but like, how can women advocate for themselves when they finally get into that doctor and say, look, I know it's my pelvic floor, help me?
Right. So I think the first thing is women just aren't aware. So the first step is kind of understanding your body, that the pelvic floor muscles exist. They help with everything from peeing and pooping and sex and birthing and exercise. And if something is awry, learning about your pelvic floor and knowing what could be a contributing factor is step one. Step two is, how do you get help? The good news is that in medical care now, we have a variety of options. You can go see an in-person therapist. You can do online programs. You can read a book. There's a lot of avenues to get help. But if you go see someone and you say, hey, I'm leaking urine and I don't really like it, and it's starting to get a little bit worse. If they say, give it time, don't worry about it, it's normal, you need to go see someone else, because that is absolutely dismissive. These issues are common, but they're not normal, and they're actually very treatable. And if you don't treat them, they just get worse with time, with aging, with activity, with changes in hormones in menopause. So I absolutely encourage you to continue to seek help. And again, there are so many options that you don't even need to go see a physician. You can go right to a pelvic floor therapist, or get resources online, or even reading a lot of the tips in the book to just help you get started to address these problems.
So, and I think, and also a misconception that a lot of women have is like, I won't have a pelvic floor issue because I haven't had kids, right? Or I'm only 27. So let's dispel that. Any woman can have pelvic floor issues, or only women who've had, or only women who are in menopause, or only women who have had babies. It's all of us.
It's everyone. It's everyone with a pelvic floor. And, there are times in our life that make us, that put us at higher risk for pelvic floor issues. And those are pregnancy, giving birth, whether you've had a vaginal birth or a C-section. Another myth is that only vaginal birth moms have pelvic floor issues, but that's not true. A C-section causes dramatic changes to your abs and pelvic floor, and pregnancy itself affects your pelvic floor. So pregnancy, childbirth, and then again, menopause. But young women, whether they are becoming sexually active and having pain with sex, female athletes in high school and college experience urinary incontinence. Almost 50% of female collegiate athletes and high school athletes can experience urinary leakage, and they've never had kids. Young women who are menstruating, learning how to insert a menstrual hygiene product, knowing that painful periods or an early indicator of endometriosis. I think if we don't talk about these issues, we don't know what's normal and what's not. But it's not just birthing moms or older women. It's everyone with a pelvic floor at every age and stage can really have a pelvic floor issue.
Are you a leader in public child welfare or with an agency looking to create real change? At RFC 21, they don't just consult, they transform. As passionate advocates for progress, they understand the challenges you face. From skilled guidance on grant management and leadership strategy to provide expert witness services for your public child welfare cases. They help you transform the system that serve communities of color with purpose and intention. Their team of resourceful professionals brings integrity to every project, knowledge to every challenge, and innovation to every solution. It's time to move beyond the status quo to build something better together. Visit rfc21.com today and join the progressive movement reshaping public child welfare systems across the nation. Wow, this is really, really great. I'm loving all of this. So they go in to see their doctor. They're getting dismissed. They're not being recognized. What's a way to find that right doctor? What advice would you say, like, hey, ask these questions for your next, does it have to be an OBGYN? Should be at a physical therapist, like someone like yourself? How can they get through the door and feel empowered to do so?
It takes a lot of courage to talk about these issues. And I think that that's why a lot of us aren't even aware that the pelvic floor exists or that this type of therapy exists. I think the narrative has often been like, one, we don't talk about this part of our body. It's private. It's kind of secretive, sometimes even embarrassing. And so when issues arise, we don't know who to speak to. The other thing is that in our medical system, there's a doctor for your uterus. There's a doctor for your bladder. There's a doctor for your colon. But your muscles, your pelvic floor muscles are connected in all of those arenas. So I think the first thing is to whichever doctor you're seeing next, whether it's your OBGYN, whether it's a urologist, whether it's a primary care doctor's, the research is clear. If a doctor isn't going to ask about it, patients aren't going to tell. So you have to kind of make very sure that you're ready to go in with your questions and complaints and say, hey, this is what's going on. And then be direct. I've heard about pelvic floor therapy. I'd like to go see someone. If they don't have an option, you say, can you speak to someone else? Or, can you look up in your hospital system if there's one? Or go on Google yourself. You do still have to be the advocate for your healthcare. Unfortunately, we can't hand it over to doctors. You have to do the research and really kind of come up with options. So ask your friends, ask your doctors, go on Google. There's pelvic health PTs in every major city. And then, again, there are resources online fitness programs, books, things like this to really kind of just get you comfortable talking about your body and understanding it.
Oh, such good advice. So when a patient is working with someone like you, who's a, pelvic floor physical therapist, that's using exercises. Describe what those exercises are so we can kind of demystify what it is and that it's okay to be uncomfortable and we're going to touch you and it's going to what are some of the therapies you would do with a patient?
Such a great question, Carrie. And I think it's really mystical. What is pelvic floor physiotherapy? So, and people often call the office and ask, what should I wear? I'm like, anything you want, because you're going to be taking your pants and underwear off. It's the way that we approach these is it's very private. So you're in a treatment room that's one-on-one. It's a closed treatment room. It's not like you're in a big physical therapy gym and you're one-on-one with a pelvic floor therapist. And first, they're going to ask you a lot of questions. You may be there for urinary leakage, but they're going to ask you about your sexual health, your menstruation, your childbirth history, your exercise, to get a big picture of kind of what your activity and your pelvic health looks like. And then they're going to do an external examination, kind of with your clothes on. They'll look at your back, your hip muscles, see if you have any tension or scarring on your abdominal wall. Then they'll step out, you'll change, and you'll undress from the waist down, and you lie down on a table, and you're covered with a sheet. So it's not like you're in stirrups or a gown like at a OBGYN. Sure. And then they do a pelvic floor assessment. But the way that we assess the pelvic floor is through the vagina. So we kind of externally ask someone to do what we call a Kegel contraction and then see if they can contract and relax. Then we ask them to push like they're birthing or having a bowel movement. And then we insert a glove lubricated finger into the vagina. We have them do the same thing to test the muscles. And then we press to see if the muscles are tender or tight or in spasm. And then that's the exam. And from that, and your symptoms, we're able to say, does this woman need strengthening? Does she need relaxation? Does she need a combination of both?
Got it. Got it. So, say I come in, I'm somebody, I had a C-section, my abs are, I'm a mess, but I need some therapy. How long does that therapy? I'm sure it varies with every individual patient, but how many treatments? Like how much time until someone really feels, oh, this is making a difference? You know, like when you go to the gym, you're not going to like bench 200 pounds on your first day. You know, you have to work up towards it. So what's typically like the cycle or a session for a patient?
That's a great question. And so, typically the sessions are 45 minutes to an hour long, and we see patients maybe once a week or once every other week. You're not coming in 3 days a week for 30 minutes to an hour. We do give you things to work on at home. And this could be everything from addressing how you're sitting, looking at how you're breathing and contracting your pelvic floor during workouts, changing your, posture for urination and bowel movement. So a lot of it is education and then also exercise. I would say between 8 to 12 weeks, so 2 to 3 months, you should start seeing some meaningful change in your pelvic floor progress. Now, will you be cured? Likely not. This is kind of an ongoing situation where you're going to need to do things at home. I always say it's not the 1 hour a week you're in my clinic. It's the other, 23 hours of the day, 6 days a week that make a difference.
Yeah.
But if you're really consistent with small changes, you can absolutely make progress. I would say the other question we get a lot is, do I have to do these exercises forever? And it's yes, but not to the extent that you do in therapy. It's like brushing and flossing your teeth. You don't have to do it, but you may get a cavity or decay. So there are some small maintenance things that you want to do, a few days a week, every week, but it's not a lot. And once you get there, it's really easy to maintain.
Gotcha. Everybody do a Kegel right now.
But also relax.
But relax. Okay, let's relax. Okay.
It's the contraction and the relaxation.
That's the hard part, Sarah.
I know.
Okay, right. I'm going to relax.
All walking around with a ton of pelvic floor tension.
Right. Okay. Worst case scenario. They go see a doctor. The doctor sends them to see you. They have wonderful effects. But every time they sneeze, their uterus is still falling out. When is it like, okay, girl, you got to have surgery?
What I would say is when you feel like it's affecting your quality of life to the extent that exercise isn't enough. So I've actually had several patients recently, most of them postpartum moms, who they have a pelvic organ prolapse, which is when your pelvic floor muscles aren't supporting your organs as well. So your bladder, your uterus, or your bowel is going to start to push into the vaginal walls, and it causes heaviness or leakage. And when you can't run or you don't feel like you can be sexually intimate, or even at the end of the day, you're in pain or discomfort, and you can do all the exercises in the world, but they're just not giving you the relief that you need, that's when I would say consider the next step. The interesting thing is that 30% of women who have a pelvic organ prolapse surgery will have a repeat surgery within 10 years.
Oh.
And the reason is because they don't learn how to engage their muscles, strengthen after surgery, and prevent whatever caused the prolapse in the first place, which is breathing or pressure management or straining. So just like you would go get a knee replacement or an ACL surgery and you get therapy afterwards, you should absolutely be doing the same thing before surgery and after surgery. So therapy should bookend that surgery, but I think surgery is a great option for people who need it.
Yeah, absolutely. As someone who's had knee replacement surgery twice, it was my physical therapist who is now getting a Christmas card from me every year. I absolutely loved her, and it was the best decision I ever made, but I had to exhaust so much before that final decision. But it was my physical therapist that got me ready for surgery and prepared me for after surgery. So shout out to PTs out there.
I love that. And we love that. I mean, I think one of the beautiful things about my job is like the connection that we make with patients. And it's really not so transactional. It's really relationship building and kind of knowing about them and their lives and really helping them get the tools or exercises to improve their quality of lives. Like, I want people to move and run and feel good in their bodies. And so my job is to not say like, hey, this is the one thing you need to do. It's like, okay, what are the different things we need to pull in to help you reach those goals?
Yeah. Okay, really, really important question of the day. If my pelvic floor is super, super strong, do I have better orgasms?
Yes or no. So this is a tricky question. If you have a strong pelvic floor, you can have stronger orgasms, which is awesome. So when you have an orgasm, the outer layer of your pelvic floor muscles contracts and relax. That's kind of that rhythm, that rhythmic wave of muscle contractions we feel. However, if you have tension or tightness in your pelvic floor, that's like too tight, you can have the inability to have orgasms. So sometimes we see people, I know, sometimes we have people who they have so much tension in their pelvic floors that their muscles can't fill with blood and contract and relax. So often people have to relax their pelvic floors and then work on strengthening. But yes, stronger pelvic floor muscles can help you have stronger orgasms and more engagement and more, in have more enjoyable sex. Like the vagina's tighter. It's, the walls are kind of more closed. Unfortunately, I think that we think, oh, I'm just going to walk around with a tight vagina all day and that's going to help. But tension doesn't mean strength. It's the contraction and the relaxation that's really important.
Wow. Women supporting women through travel. Solo doesn't have to mean alone. Two Peacocks Travel brings women together through thoughtfully curated group trips that go beyond sightseeing. Every journey is designed to empower, encourage, and create lasting friendships. From shared laughter over a local meal to supporting each other on an adventurous trek, these experiences foster a deep sense of sisterhood. Plus, with a focus on compatibility and shared interests, every trip ensures meaningful connections, professional networking, and even future reunions with your travel besties. Ready to build your global sisterhood? Head on over to twopeacockstravel.com and meet your next travel bestie. Now, let's switch gears and talk about the book. Tell us when it's available, but then I want to know what was the, motivation behind it? What was the catalyst for you to birth this baby book to really make the impact you were really hoping for? Like, what drove you to finally I'm going to do a book?
So my book, Floored, A Woman's Guide to Pelvic Floor Health at Every Age and Stage is available June 10th. So I absolutely encourage you to get it. And it's for everyone with a pelvic floor. It's a woman's guide, but if you've got children, you've got parents, you've got partners, I think it's really important to understand your body and have preventative tips to help prevent issues. And then also things to help right now if you are already experiencing them. I can't say that I've had this like master plan of my career of like, I'm going to start an Instagram account, then I'm going to start an online workout platform, then I'm going to write a book. A lot of it is listening to people and they're telling me what their needs are. So the book sparked because a follower on social media on my Vagina Whisperer Instagram account wrote me an email cold. And she said, I'm following you on Instagram. And I think what you have to say is really important. There's not a lot of books out here. And I'm an editor for HarperCollins. Would you think about writing a book? And I was like, well, I've never really thought about that. She's like, okay, well, this is really important. And so I actually had to shift a lot of things in my professional life. I owned a clinic here in New Orleans, a pelvic PT clinic, and I sold the clinic in order to make the space to write the book because
Wow.
I had young kids. I have an online fitness platform for pelvic floor exercise. I was like, I can't do all of this, right? So I shifted and I carved out space to write the book. And I always came back. I think sometimes it's like, why am I doing this? And you always come back to that North Star. And my North Star is I want more people to understand their bodies and I want more women to get the care that they deserve. And they're not getting it right now. They're not finding out about pelvic floor therapy until they're already experiencing problems. And I want to help them prevent those problems or get help sooner. So anytime I was like too tired or felt stuck in a writer's block, it was like, why am I doing this? And you just come back to that North Star and it really kind of gives you the motivation to keep moving forward.
Oh, I love that. Okay, so tell me about the V-Hive. Yeah, the V-Hive. That's like not to be confused with the Bay-Hive because that's Beyonce.
So that's where I got my inspiration from.
Oh, great person to get inspiration from. Now, she's been pregnant with twins. Who knows what her pelvic floor is like? And she dances. Oh, my gosh.
She might have the best care of any of us. So, I started the V-Hive as kind of just a nickname for my community online. But I started a pelvic floor fitness platform in 2021 when a lot of women couldn't get to pelvic floor therapy. It was post-COVID. Clinics weren't kind of in full force. Women were scared to go on it. They were pregnant or postpartum. And so I developed a program of online pelvic floor exercises, and it was just for postpartum women. Like, how do you strengthen and rehab your pelvic floor after giving birth? And then I developed one for pregnancy. Then I created one for perimenopause and menopause. And I created one for painful sex and tension, for after surgeries like prolapse or hysterectomy. So it was really kind of just in response to what I felt like people needed at home. I mean, nothing beats going in and seeing a therapist in person.
Yeah.
But we can't all access them. They can be costly. They may not be near us geographically. And I really want to make this care accessible. So anyone who pre-orders the book, it's 30 days free in the V-Hive platform, because I want you to have access to this information right away. But I think it's just another avenue for people to really kind of get the exercise and education they need at home in a really easy to digest format.
Love that. And are they, because I've taken online fitness classes before, are they live with you, or is it pre-recorded? Like, or is it both?
They're all pre-recorded, so I don't do them live because I kind of it's a big kind of production to make them really high quality. But they're kind of me. It's like a Peloton workout. I'm walking out alongside of you, so there's exercises you can go they're anywhere from 10 to 20 minutes, so they're not like 45-minute workouts. I mean, and they're pelvic floor and core focused, but it's yoga, bar, hit. I mean, teaching you how to exercise while thinking about your pelvic floor and core and strengthening and relaxing. So it's that missing piece, I think, that's in fitness a lot. I think so often we think about pulling your abs and sucking in your stomach, but your pelvic floor is the base of your core. It's part of your core. And we really need to kind of learn how to integrate that piece into fitness.
And Peloton, if you're watching, I mean, this is a great collaboration. I have a Peloton. There's no pelvic floor exercises, but
I know. Just saying, I'm a Peloton for 2. And I'm always like, that's a dream. I live in New York. But, it's one of those things that I think I also see a lot of fitness people kind of getting into pelvic floor fitness. But I think a really important piece is that pelvic floor fitness is great, but pelvic floor is also healthcare. I mean, it's really important that it's not just thinking about tightening your vagina or exercising. It's really the basics of how to care for your body that we're just never given as women. I mean, we maybe get a little bit of period education. Depending on where you live or where you go to school, you maybe get a little bit of sex ed, but you don't get pelvic floor education. And I think that that's really where we need to start. And, there's a book in the chapter on menstruation, because I'm like, if you're a parent, I want you to educate your daughter about her body. I have 2 sons, and they probably know more about the menstrual cycle than most women because they ask me questions. They're like, "Are you bleeding? Does it hurt? Where is it coming from?" And kids are curious. So I think if we can really change how we view our bodies and what we know about it, we can really change the narrative for the next generation so that they feel more empowered in their bodies as well.
Yeah, I agree. The conversations I have with my teenage daughter are very different than the conversations I had with my mother when I was that same age. So I think it's also generational, right? We're more open to discussing things like this, and there's more accessibility to things like your book or your exercise or your Instagram account that just makes people just like, oh, let me see. I do have a pelvic floor. So you're kind of demystifying it, which is really what we need more access to, especially us as women, because our access to healthcare is getting harder. So it's like we have to advocate for each other. So I love everything that you're doing, Sara. This is absolutely incredible.
I could talk vaginas all day. Here you go.
Right? Okay, Sara. So a lot of my audience are approaching perimenopause, are in menopause. What specifically would you recommend advice for those women? Any kind of symptoms they should look for, any advice you would give them specifically for those women who are like, all right, what's happening?
Absolutely. And this is such a time of life that we're going through so much transition. And I think we go into it and we feel so uninformed. And then we're like, what the heck is going on with my pelvic floor and vagina? So as you ease into menopause, or perimenopause, I should say, which could be 10 years before you actually hit menopause, is your hormones are fluctuating. So some of the early signs of these changes are vaginal dryness, kind of needing more lubrication during intercourse, more frequent urination, which maybe you wake at nighttime to pee when you didn't used to, or going to pee several times before going to bed, more frequent urinary leaks. So, oh, I didn't used to leak when I cough or sneeze and now I am, or a sensation of pressure or heaviness in the vagina. So these are all changes due to hormones because you have less estrogen, which causes vaginal dryness. You also have less pelvic floor tone and endurance. And then what you need to do is be really proactive. I mean, I think we don't want to wait until menopause hits and then we feel like we're trying to swim upstream and play catch up with our pelvic floor. proactively strengthening your pelvic floor during perimenopause is key. Just like we talk about strength training to build bone, density and muscle mass, you need to train your pelvic floor leading into menopause. So start pulling in your pelvic floor with exercise, with weightlifting, making sure that you're not straining during bowel movements, learning how to pee properly. Don't push when you pee because that can weaken your pelvic floor. And using a topical estrogen cream, I'm a huge fan of. You have to talk to your medical provider, but that will kind of plump up the vulva and vagina and keep those tissues toned. And then also using a vulvar moisturizer on the days you don't use the estrogen. A vulvar moisturizer is just kind of an all natural, just like we put serums and lotions on our face, it's the same thing for your vulva, but you have more prone to dryness during perimenopause and menopause. So I think the one thing is be proactive. You don't have to wait for issues to occur to start addressing them. 2 is use this runway as like a yellow light. Like, hey, changes are coming. What can you do now to prevent them? And then 3, if problems arise, don't think that they're going to get better because they likely won't. And if anything, they may get worse. So start addressing them right away. One thing I will tell people if they are your listeners and they're, after menopause, if they've had bladder leakage or painful sets for years, is that it's also never too late. I've worked with women in their 60s, 70s, 80s who have made huge improvements in their bladder health, been able to be sexually active. They have less urinary tract infections. They leak less stool. So really kind of knowing that you can always get help, I think is really important because I don't want anyone to feel like, oh, I'm already past that age. It's too late. I don't need the book or I don't need the exercises. It's never too late. Just like you can always start strength training, then you can do the same thing for your pelvic floor.
I love that. So I definitely love the idea of a vulva moisturizer, balm. Just don't confuse it with your lip balm. And, put it in a separate drawer. I think this is really, really wonderful advice. And it seems so attainable, right? It's not like he said, okay, you're going to climb a mountain. And then once you get to the mountain, you're going to cook a 5-course meal. And then we're going to talk about your pelvic floor and menopause and perimenopause.
Yeah.
Like everything here is so attainable. Sara, any final thoughts, final advice for our listeners? We know how to find you. We're going to get the book, Floored. We're going to follow you, the Vagina Whisperer on Instagram. Final thoughts? What do you think?
Yeah, I think one takeaway is that I just want women to know they have a pelvic floor. I want them to understand what it does for their body because it's working for us day in and day out. And I also want them to know, like, every season of life, it requires different things. Whether you're a new menstruator, whether you're sexually active, whether you're pregnant, postpartum, perimenopausal, that we require different things in our life for our bodies. And so having those tips and tools can not only help you overcome problems, but also prevent them. So I'm really honored to be able to have this conversation with you and your community. And I'm like, more vaginas in the spotlight. That is how we're really going to help women.
Yes, we need like a thing, have like there's the heart. You need like a thing. Yeah, like that, Sara.
Maybe that'll be it.
Okay, that'll be it.
I'm going to use that, Carrie. I love it. You're going to see me now. Everybody's going to be throwing up the vulva sign.
That's the vulva. Do your Kegel.
I will credit you for that. So yeah, thank you for having me. And it's just, again, it's, I just hope this conversation helps so many people.
It absolutely will. Thank you so much, Sara. Looking forward to reading the book for sure.
Thanks for having me.
All right, bye. Thank you for joining us for another episode of Carrie On. Be sure to find us on Apple Podcasts and Spotify. And as always, like and subscribe to our channel on YouTube. And don't forget to keep your head above the chaos and carry on.